Okay, so sorry about that. My video cut out. So we'll have two links for this then for you to view. The second piece should be pretty short, just a few more things to cover. Just wanted to talk quickly about the importance of meaningful use. About 7 or 8 years ago, the system where I work went live on Epic. There's a lot of different brands. There's Epic and Meditech and many others, but it's basically electronic medical records. There was a day where it was paper. So that is no longer approved or kosher. And the reason for that is the federal government now tracks many metrics and quality metrics, safety metrics, outcomes, that sort of thing. And so the use of the EMR helps to streamline patient information, also helps with access as you may go from clinic to hospital. It helps with some safety concerns there, and also gives us the ability to pull the metrics that the federal government wants. So just to have a good understanding of what that means as we talk about some quality things and some case management things, that is the future of healthcare as that area continues to grow and we continue to look at best practice and how is this hospital X performing compared to hospital Y, and what are we doing different? What can we do better? That sort of thing. Have a good understanding of the greatest good principle and what that means. Utilitarianism versus, say, egoism and that sort of thing as well. When you are in the midst of like an ethical decision making process, just remembering that you need to collect the data, you need to analyze it, and then you need to interpret that data. Most hospitals will have an ethical committee that may meet monthly or every other monthly, and then ethical issues may be brought back to them for peer review, or if there's an ethical issue that is currently ongoing, may be reviewed at those meetings as well. It's important that we all understand why those nursing models and nursing theorists are so important. And then we talked about that a little bit already, but also just knowing that it helps us with providing our care, being organized and that sort of thing as well. Just remembering that what your responsibility is to your patient. Whether or not you're working a 4-hour shift, an 8-hour shift, you still have that same responsibility to your patient to give them safe care, respectful care, and being responsible. So you can't just walk on a shift. Those are things that when you hold that license, you're agreeing to do. At times it may mean that you do stay after your shift. If the person relieving you isn't there, you do have to stay after because those patients have to be cared for. You can't just walk away. So certainly those are things just to remember in that framework of professional responsibility and that sort of thing. So sorry about the two parts. I think I was able to touch on some of the larger topics and review some of the more difficult ones. I hope this is helpful. And please remember, this is our live lecture. So please remember to drop your assignment in. Okay, thank you.